Okay, so let me hit broadcast. Okay, welcome everybody. I'm going to share my screen and say hello to everyone who's here. And we're going to be with Dr. Salazar, and he's going to be talking about liposuction, HD lipo, which is high definition liposuction. And what do you do with all the fat? What do you do with it? When you move it from one place, can you put it to another place? And if so, where might that fat want to live in a new home? So we're going to give everybody a couple moments to get into the room, and we'll just start in about 1 minute. And we're also live on Instagram, so we'll have that there for anybody else who might be joining. And then we will be putting up, we're recording this, so we will be putting up the recording of the whole thing. So if you can't stay for the whole time, we hope you can, but if you can't, then you can come back and watch later, or you can also watch any of the ones that we did for the last couple days, because we've had some really great quarantine sessions and spilling the tea on all kinds of hot topics. So I'm going to stop sharing and let me go one more slide over. Oops, hold on 1 second. To Dr. Salazar is your man of the hour. So he is a board certified plastic surgeon and has been practicing now with us for a couple years, but prior to that, he was in Houston and here in San Diego, and has, been accepted into the American Societies for Aesthetic Plastic Surgery, which is a huge honor. He's a fellow of the American College of Surgeons, which is also another amazing designation. And the circle logo, the American Society of Plastic Surgeons, lets you know that he's a board certified plastic surgeon, because there is a difference between a plastic surgeon and a quote unquote cosmetic surgeon. So he also last year was voted as San Diego's favorite, which is really exciting. And so let me hit the next button, and I think I've got the wrong slide that you're now seeing, but I'm going to switch it over to Dr. Salazar. There he is. Hello, Dr. Salazar. And I want to make sure everybody can hear you.
All right. Can you hear me? We're testing.
Yeah, we're good. I'll let you take it away.
Very good, Monique. And thank you so much for setting up this type of meeting. It's great because this way we can stay in contact with our patients. We can discuss several topics that are of interest for people, that as well give us some entertainment, something to do while we're in the quarantine. And I think that was a great idea. As a matter of fact, I have my cup of tea over here, and I'll take a little sip. So we'll start, and what the team over here at La Jolla Cosmetic Surgery Center and I were discussing is to try to touch base on a couple of topics that are very in vogue these days, and those are liposuction and fat grafting and placement of the fat that you remove. What do you do with that fat? Also, we have brought here to San Diego a technique that's called HD liposuction, that we do it in a special and particular way with a non-heating generating device. So avoiding some of the potential risks of doing HD liposuction with other different devices that surgery is also performed. I'll touch a little about that and what are the differences. So the first topic is about liposuction. So what it is. What is liposuction exactly? So what that is it's a surgical procedure. It can be performed under local anesthesia if you're going to be addressing a small, very well localized part, one or two parts of the body, but mainly we like to perform liposuction of larger areas under general anesthesia. And the way we perform liposuction is we make a very small, we make a nick, truly nick incision on the skin. And then what we do is we use first what we call tumescent solution. That's saline fluid that has medication in there that's mixed. And what we're going to do is we're going to put that fluid inside that body part where we're going to be doing liposuction to prevent bleeding. After we do that, then we use our liposuction cannulas, which are long devices, but very, very thin that actually can fit through that nick incision. And we truly empty the fat out of that body part. After that, what needs to happen is that the skin and the tissue needs to retract, needs to contract after we have emptied that, the content of the fat of that area. And we have different tips and tricks that we need to follow in order to allow that tissue to reshape and conform into a better body contour. So just to start giving you some examples and for us to be able to tell the difference mainly between that HD liposuction and regular liposuction, let me bring up an image over here. And here we have our screen. This is a system that the system's called TouchMD, and we have it in all of our consultation rooms. And this is a great educational tool because it allows us to show patients some diagrams, some before and after pictures, and probably, let me see if I can adjust over here the image a little bit better. There you go. So over here, let me show you. So this is a patient, for instance, in which we did regular liposuction. So you see how the overall abdominal contour, this area is right here, and the center of the abdomen has a much, much better shape, better definition over here, and a much better contour, as well as on her thighs. We also did some liposuction. She didn't like the middle or the medial aspect, as we call it, of her thighs, and we decreased that, and we actually made the screen disappear. There you go. And we are able to achieve all these changes through those very small nick incisions. So liposuction gives you an overall better contour, better shape. We can eliminate some of the fat. We don't eliminate all the fat, of course, but it's a procedure in which the patient comes in with a certain concern of a certain area, and we can reshape it overall. So you see that same patient, you can see her back, how this area over here of her hips and her waist has changed. And definitely it's a big change. It's a change for good. She's very happy. But of course, we have something else, and we can bring that HD liposuction into the game, and we can take liposuction one step above. And with HD liposuction, these are kind of the results that we can obtain. I think you get a little bit of reflection of your screen over here, and but I'm pretty sure you can tell the definition and the difference between this patient here and his before picture. Not a very fat patient, right? Not very chubby, but he has a little bit of fat, and he always said, you know what, Dr. Salazar, I exercise a lot, but I seem not to be able to lose that weight and get good definition. And that was true. When I was actually examining the patient and I was pushing on his abdomen, I could feel his muscles that had some good tone over here, but no definition, as we can tell. And that's how powerful that HD liposuction is that you can see the change in how he dramatically has changed from this to that. You can see a good definition of the linea alba, the linea semilunaris, and the descriptions of the muscles. Fancy word just to say, look at his six-pack. And our eyes can tease us a little bit, and we can actually think that it's because he was exercising, but not really, not in reality. This is not the result of exercise. This is actually the result of the liposuction itself. Let me share here another picture. This is all. Apologize for that. Let's see over here. There's also a female patient. You can see how we can better define those inscriptions, those lines that define the abdominal musculature in a much more accentuated way, but also in a much more subtle way on a female patient than on a male patient. And how is that, how do we do that? How's that procedure performed? So just take exactly what I told you about regular liposuction. And with regular liposuction, we said we make a small nick incision through the skin in which we can actually put our cannula in. We put that fluid that we talk about to decrease the potential bleeding. We wait for some time, and after that, we start doing the liposuction with the cannulas, the instruments that are of a small caliber that give us access to be able to empty that fat. So the tissue, the fat tissue, the subcutaneous tissue has two different layers. One layer is the deep layer, and the other layer is the most superficial layer, the one that's very close to the skin. When we perform regular liposuction, what we do is we go in and we tend to remove fat from the deep fat compartment. When we do HD liposuction, we remove all the deep fat compartment and we start working on the superficial fat compartment. And not only we decrease the size of that superficial fat compartment, we empty the deep fat compartment and then we sculpt the superficial fat compartment. So the mountains and the valleys that you see on this picture here are actually caused and produced by removing and sculpting the fat in different levels in different areas of the body. So that's how we can achieve this result. And I feel that in talking to patients and patients that actually underwent have undergone this procedure, this is real liposuction taken to the next level. I feel that patients nowadays, they don't only want to look good, feel good, but they also want to have that extra. And this procedure actually brings liposuction up to a new era, I think. So let me show you. I want to share with you a couple of pictures of how that progress is made little by little after that HD liposuction takes place. One is HD liposuction. It's a much more involved procedure, but in terms of recovery, and we'll talk about that, it doesn't prolong your recovery. It's a much more involved procedure in terms of the surgery and the recovery, but it's not that we go deeper or we invade other structures or other areas of the body. We stay very superficial the same way that we do with liposuction, very, very close to the skin. And let me show you here, this patient. And tends to recover pretty well. Not right now. There you go. Well, there you go. So this is the before of this patient, and this is an immediate after. So over here, what we see is, again, a patient that it's a little bit on the heavier side, but again, he's not very fat. at the same time, he's not extremely thin. But he was actually a very active patient, and he wanted to get that definition and decrease the size of what he called his love handles and, or technically the flanks and the lower back, and also get better definition of his abdomen. So we did the surgery as I described it. It's a surgery that takes about 3.5, 4 hours. And that, when we compare it with regular liposuction, is probably 80% longer. I wouldn't say that it's double, but it's close to double the amount of time that we have to invest when we're doing the surgery. And again, it's easy to understand because we're not only going to be working on the deep fat compartment, then after we're done with that part, then we start the second surgery, which is the surgery that gives us the definition. So you see how we did his surgery in terms of the middle neck incisions, 1, 2, 3, 4, and 5. And what you can see here is not that it was snowing or anything. What you can see, like the little white things are part of the foam that we apply after surgery. And let me try to make this, I don't think we can make it bigger, but you can see on the details that we provided him with a much better contour, like on his sides, on the flanks, and probably over here for Instagram, it's easier just to look at this side over here. And other than providing him with a better contour, we created that definition. You can see the transition from the chest to the abdomen. You can see that middle line, and you can see how we created those inscriptions of the muscles. Now, let me tell you something. I use the word created. In a way, yeah, we do create, but what we do is we only reflect the own anatomy of the patient. The patient has his own muscles, and we spend a good amount of time, probably I would say 25, 30 minutes before surgery, just to find where those muscles are and where are those inscriptions, where are those natural lines, because the only thing we do is we reflect that. We don't come up with a design of the patient's muscles. Those muscles are the muscles of the patients, and we're just reflecting that on the subcutaneous tissue, on the fat and the skin. So when you look at that picture, and I tell patients when they're here and we're having a consultation, I tell patients, well, actually over here, you're gonna think, oh my God, what did I do to myself? I don't want to look like a Ninja Turtle. What is this? This looks a little crazy. I prepare the patients for that stage, that first week. When we remove the dressings for the first time, we leave the same dressings for 1 week because we really want to be able to accentuate those inscriptions, those lines, and we remove those dressings, and patients get really surprised. So first, they look at a different contour, and they look at this, a little bit of a cartoonish image. So as they come here in preparation for their surgery, we always digest that part. So, but you're gonna see, this is the patient's back. You can see that definitely the contour starts to look better, but you can see again that little bit of a cartoonish look that we talked about. And now you can't see anything. See, it's coming back. Maybe. And classic, and the funniest thing, if you ask me how many times have I had that problem, never. But it had to happen today. And it's hard to tell you or to show you some of the results without it. Let me see. It's going back up, and we might need to set it up and turn it up again. 1 second. So. Just give us one moment, give us 1 second, and we're gonna be fixing it. So the progress or the process is a very involved process. As I was telling you, it's a matter of we see the patient, we do the surgery, then the patient comes back after 1 week. After that week, what we do is we wait for another week. We see the patient again, and then most likely the patient will see them then after 2 weeks. So that's like for a 1 month out visit. And we're bringing it up in a second. If you can give me one moment, and let me just turn this way. There you go. We'll probably bring it up in 1 minute. So so as I was telling you, it's a very involved process in which the patient after the surgery gets lymphatic drain massage. I actually, as we were setting up the recovery for patients that had this procedure, we looked for a qualified person, and we were very fortunate enough to find Sylvia. So what happens is, after this procedure, imagine that we have the skin, we have the fat, and then we have the muscle underneath. What we want to do is want to empty everything and then allow the skin to heal on top of the muscle. So what we cannot have is we can't have any fluid in between, accumulated between the skin and the muscle. So what we do is patients have this lymphatic drain massage, and what that does, it mobilizes all the potential fluid that can accumulate, and it gently brings it back to the area, away from the area that we wanted to heal. And that gives a very good, allows the patient to get a very nice quick recovery, and the skin to start that retraction and contraction. You will see when I'm able to show you the pictures, but you will see how that during the recovery you get a lot of a very powerful contracture. You can see how the skin retracts and actually gives a completely different contour to the patient. Monique, are you there?
Yes, I am.
Is there a way that we can get some help? Maybe maybe Janelle, if she can come in and
with the TouchMD. Yeah, I can. I'll give her a text. And then in the meantime, though, we did have a question that I thought I might tell you, is that one of our people on the Instagram has asked, is it full anesthesia?
Is it full anesthesia? So yes, 100%. This is a procedure, this HD liposuction, definitely you want the patient to be completely relaxed. You want, as you know, our first concern is safety. So for the safety of the patient needs to be completely standing still, and we can work on those different areas. We have to turn the patient, so we do it with a team of 5 people. We turn the patient very slowly and very gently, so we can actually work in different areas of the body. So definitely having it with general anesthesia decreases the amount of risk for this procedure, and actually makes it much more of a pleasant experience for the patient. Well, okay, that's great. I think we're gonna go back in, and
And in the meantime, I was thinking what we can do is we can post some of the pictures that you've shown. So maybe on Facebook and on Instagram, we could post some of those slides, slides that you were talking about, so that everybody after the session, we can put those up for you to kind of get an idea. And for people on Instagram also, if you look at our Instagram profile under LJCSC, you know, there's the little story highlights, and we have quite a few HD lipo story highlights, including one of the patients you saw as an example there, where you can actually see some of the surgery being, you know, the markings that Dr. Salazar is talking about, the surgery, and I got to be in the OR live, so it was actually it's very, very interesting. And then you can see some of the post-ops, and because I know this isn't super clear. Oh, good. A lot of people like that idea. Thank you. Yeah, so go over on our Instagram and look at our story highlights and just scroll along, and you'll see we have a couple different HD lipos, so that you'll be able to really get a good idea. And I'll let you go back to presenting, Dr. Salazar.
You know, this is perfect, because again, you can totally see again the change in that contour of the patient. And still, as I was telling you, this is still 1 week out, and you can see how the patient still has some inflammation after surgery and has that dramatic result that it's a little cartoonish over there. And we are stuck again. Let me see. Let's see. I have it here. So that's the first week. And then we go into 3 weeks after surgery. So over here, you don't see any more of that cartoonish look, but what you see is you lose a little bit of that definition, and it starts to look a little bit more human. It definitely looks a little bit more human, and patients start feeling reassured. And as you can see, you can start seeing a very dramatic result from here to there. And in person, when you see it on 3D, it's much, much better. But let me see if I can show you the back of the patient. And you can totally tell. And patients over here start, when we go over some pictures, we'll say like, oh, that looks like a different person. You can start to see how the deepening of the muscles start to show over here. And let me show you a picture on the side. Let me see where we have it. So we'll be patient. Hopefully it'll come back. Okay, PC run into a problem, and it's gonna resume again and restart. Maybe 20% complete.
I think we're testing the limits of bandwidth today.
Definitely, and it's funny because I've never actually, I must say that I've never actually seen this happen before with this system, but
yeah, I think it might be a bandwidth issue. We're sorry, everybody. We're streaming on Instagram and on Zoom, and so I think we found a new problem that we will fix for next time.
Mm-hmm. Yeah, let's put it back up again, and let's see if we can.
So I had one question from the audience. How long can the results from HD lipo last?
So those are, that's a great question, because the results are truly permanent. One of the things is for, I hear all the time when like patients come in very concerned because they say that, Dr. Salazar, I hear that if you get liposuction and you remove some of the fat in certain areas and then you gain weight, you gain the weight back in other areas. The concept is right. It's correct. It's partially true. The areas where we remove the fat, you're never going to gain fat in those areas again. what we have seen with patients that undergo HD liposuction is that patients have such a dramatic result that they preserve the results really well. And they tend to, I mean, we've seen where patients start to eat much more healthier. They start to exercise even more after the procedure. They tend to take care of their bodies much, much more. Let me go, and since we are up again, and I really don't want to miss the chance to show you the a good final result or a couple of results, hopefully. Let me take you to a three-month office visit or after surgery. So over here, you really get to see the power of this operation. Again, over here, and the difference is just the procedure that we perform. So you can see how the patient size has totally changed. This patient claims that he has lost, in terms of his waist size, from being a 34 to a 30 in terms of his waist. And you can see the definition of the muscles over here. You can see that line that we call the sign over here. Size and line that continues and gives that sexy appearance aspect. This patient actually, let me show you a side view. And you can see that it's, you can look at the width from here to here and compare it to this, and all that is a contraction, that contraction of the skin and adjustment of the skin over the new contour of the patient's body. It's totally an image changing procedure. Let me show you a different patient. And in his case, we can also see we did not only work on the definition of his abdominal musculature, we also worked on his chest. And what we did is we actually did liposuction in all this area here to give a much better definition of the pectoralis major muscle, the chest muscle. And we also, and as we started to touch base on what to do with all the fat, we also injected some fat in the upper pole, in the upper aspect of the chest, to give him more volume and the appearance of having a thicker, a much stronger pectoralis muscle. And then we empty it. You look at the distance from the nipple to the crease of the breast over here of his chest, of his male chest. You can see that that distance has decreased in size, and that gives him the appearance of having a much better fit chest. The same thing over here. You can look at the difference between the abdomen, and over here we did not do any tummy tuck or any other operation. It was just the pure HD liposuction. One of the concepts that's important, and I keep saying the retraction of the skin and that contraction of tissues, is that when you do regular liposuction, you do not get this powerful response. When we do regular liposuction and you're going to be emptying all that, you are concerned to develop a little bit of extra skin and hanging skin. And sometimes when we see a patient that we think that the patient will benefit from a tummy tuck, from an abdominoplasty, because we're going to resect not only the fat but the skin as well, we can now offer them, not to every patient, but to some of those patients, we can avoid having that incision of the tummy tuck and offer them HD liposuction. Let me show you another result of a patient that's a very thin patient, and the patient was saying that definition.
Let me just break in. We are getting garbled audio, and I think it might also be that bandwidth issue. So hopefully we can
see how better now?
No, it's weird because it goes in and out of being sort of garbled and being not, but I think it has to do with TouchMD and moving slides.
Probably, because again, I never experienced this difficult times with TouchMD, but at the same time, we're never broadcasting at the same time when we're getting a consultation. I don't know if you can hear me well now, or?
Yeah, you sound like you're in a wind tunnel combined with some weird electrical forces.
What happens if you difference or not at all?
No, it doesn't. We only hear it when you start to talk.
Okay, so and the feedback that I'm getting from Instagram is that there's good audio, I think.
There's what?
They can hear me well on Instagram, I feel.
Oh, good. Okay. Zoom is it's all garbled, so I apologize for that.
Some notes on the show.
We can go way back, really old school. I don't know quite what the best thing to do is.
So I'm getting feedback on Instagram and saying that we have good audio, but
it just could be that what computer we're using to broadcast to Zoom is the problem.
So I say for Instagram audience, or if people want to migrate from one platform to the other, meaning people from Zoom can join us on Instagram, maybe we can continue over there.
Yeah, and now you just cleared up. So I think if we don't do too much with
the screen.
Yeah, let's try that.
Okay, so let me just promise I'm not going to do much more with the screen. We have, as you can see, we have several patients with those that underwent that surgery, and in terms of a female patient, as I was showing you, you get that dramatic change that it's hard to get with just regular liposuction. You can see over here the ratio of the waist and the hips, and you can see how much accentuated that is. In her case, we also, and that's really important, we can better define the contours, and we can better define the difference between the lower back and the gluteal region. So by just doing that, it gives you the impression that you develop a better, larger, better defined buttock. And with the fat that we have removed, we process that fat, and also, as I said, in terms of the male chest, to give better definition, we can inject it, and also we can also do what we call Brazilian butt lift, or the fat grafting of the harvested fat to the buttocks, and that we can give a much more dramatic result and a better profile for the patient, if that's what the patient wants. Some patients actually say, you know what, don't inject it, don't put any of the fat back, just throw it away, I don't want to see it anymore. And there are some patients that actually say or think that it's beneficial. We come up with an estimate of how much the patient needs, and it's a very safe procedure as long as it's performed in a way that in a very anatomically oriented fashion. So that's pretty much I would say what we can do with the fat that we remove. Can we inject that fat in other areas of the body, such as specific areas of the face, for instance? Can we put some of that fat on the lips? Can we put some of that fat on the nasolabial creases and the nasolabial folds underneath the eyes? Yes, it's absolutely yes. We can use that fat to inject it in different areas. Same thing, can we put some of that fat on the breast, in a female breast? We can. We can also do that.
Yeah,
no, I was going to say, as a matter of fact, one of the last cases that we did, the patient actually wanted to build up his calves, and we were able to inject it on top of the gastrocnemiae muscles. Those are the muscles of the calf, and we were able to inject the fat over there, obtaining a fabulous result.
We have a question from the audience. What qualifies you for HD lipo if you don't want the incision line? And I don't know if they mean the incision line from the tummy tuck. Okay.
Yeah, it sounds like it. I think what really, I mean, let me give you the kind of the textbook answer would be, if it all depends on the quality of the tissues of the patient, the elasticity of the tissues, right? How much contraction, how much retraction the patient can provide. With HD liposuction, we are able to irritate so much the underneath aspect of the skin, the underneath aspect of the dermis, that we boost those qualities. We did HD liposuction on a patient that, if you think about a 75-year-old patient, you think that the elasticity or the quality of the tissues are not going to be the same that on a young patient. So we had a case in which we were talking to a patient that is in that range of age. I think he was 72, and we talked about a tummy tuck versus HD liposuction, and we went and we did HD liposuction, and he has retracted incredibly well, meaning he has completely avoided the need for that abdominal incision. And just with this, we got rid of the fat and we got rid of that extra skin. The level of retraction is good, is important. I don't want to ruin it again, but you can see how this patient, actually, we were talking to her about a tummy tuck, and you can see how much retraction she got. It's maybe a little tricky to see it on the screen, but you can see these are pictures that she very nicely shared with us, and of course allowed us to share with everybody. And but you can definitely see that maybe if you assess this patient, you might think, well, maybe a tummy tuck is what she needs, but just with the HD liposuction, then you were able to gain a much better contour. It's just important, I would say, Monique, for me to be able to examine the patient and together come up with a nice plan.
Yeah. So one person asked, why do some patients qualify for HD lipo versus a tummy tuck?
Can you repeat that question again?
Why do some patients qualify for HD lipo versus a tummy tuck?
I would say that the answer to that one goes along the same lines of the previous question. I would say that number one, it depends on your goals. If you want to obtain good definition and a dramatic change in the contour of your body and muscle edging, definitely go with HD liposuction. If the patient has already a good amount of extra skin, lax skin, hanging skin, definitely HD liposuction would not do the trick for that person. But if there's a minimal to moderate amount of extra skin, then maybe we can entertain the idea of going this route, avoiding that incision, and allowing to have a much better contour and a much more defined body.
Okay, and the last question, because I know everybody's got other things to do, but we just had one come through asking about, can either of these types of lipo help me achieve my goals if I'm, 25 or 30 pounds from my goal weight? Would they give me a jump start, or am I supposed to be closer to my goal?
So that's a great question. because there are two different things. One, I mean, in the ideal world, if you're going to lose weight, the best way to do it is lose weight before the procedure. And once you are in your ideal weight, to have the surgery. That's right. I mean, the ideal weight, the ideal world, the ideal way of doing things. But I mean, I'm 6'2", and I would have liked to be 7'1" and play for the Lakers, but I'm not going to be able to do that. So if that's the case, and you've already tried and you've already dieted and you want to obtain a much better contour, we can definitely examine the patient and see where the patient is. Of course, within the range of safety, within the range of keeping surgery on the safe side for the patient. But to see how much potential we can obtain, definitely examining them and taking a detailed history and examination will allow us to establish mutual goals, and I'm pretty sure patients would benefit from this surgeries.
Great. So I'm going to thank you, Dr. Salazar. This has been so informative, and to our audience, sorry for the crazy,
No.
It was like it was April Fool's Day, but
Crazy time, exceptional time. So we got for the first time, we got in trouble with TouchMD.
but we will, for the audience, I'll let you know, and let me share my screen. I'll let you know that we are doing, there we go. We're doing, we have a couple more sessions this week. We have another one tomorrow. We have another one on Saturday. And then if you wanted to have a virtual consultation, which we haven't had any issues with, technologically speaking, with Dr. Salazar.
We just finished one. We just finished one right now, and we have another one after this, and we haven't had any problems.
So we have, but you can, call or text us to have a virtual consultation, or email us at lookgreat@ljcsc.com. And if you want to join our text list, you can text the word GLAM to 858-452-2066, and you'll get the latest. And then lastly, because it was really hard to see what was going on during the presentation, and we apologize, we'll put those pictures up as a post on Instagram and on Facebook. So come follow us at LJCSC on Instagram, and on Facebook at La Jolla Cosmetic Surgery Center, and we'll show, so you can really see how great these results are and how much definition Dr. Salazar is able to provide. So thanks everybody, and we will see you again tomorrow. Thanks.
Thank you so much. Stay safe.
Okay.